Hi, AMP Honors Program. My name is Julianna. I'm a super mentor here on the AMP Honors platform. And today I'm going to be speaking with Dr. Keith Mausner. I'm going to just kind of let him run through his journey and his specialty and what he does. And from there, I'll just ask questions and kind of pick his brain a little bit. So, Dr. Mausner, would you like to just kind of explain what you do and how you got there?
Yeah. Well, my name's Keith Mausner. I'm an emergency physician. That's my professional background and training. And I have a subspecialty in what's called EMS, Emergency Medical Services. So I went through training to be an ER doc, which was always my prime job. But then secondary to that, I had a special interest in working with pre-hospital care providers, so paramedics and
Okay.
EMTs, and how to train them and how to run an EMS system. So that's my basic professional background.
And did you,
So
just a quick question, did you have to do like extra schooling for that, the EMS side of things, or was that kind of integrated into your curriculum in medical school?
no, that's a great question. So, first of all, I'm one of the old ones, okay? I graduated from medical school back in 1986.
Wow.
And at that time, even emergency medicine was a really new specialty. They'd only been offering what's called board certification in that for about 6 years at that time.
Okay.
So it was the youngest specialty in emergency medicine. And when I went through medical school, I had no idea that I truly didn't know that I wanted to be an emergency physician.
Mm-hmm.
I initially wanted to do primary care. And I
Oh,
started off in family practice. So the other thing I did was I went through medical school and I financed my medical school by having a scholarship with the military. So I was an Air
wow.
Force doctor. So I went to the University of Colorado, which was my home state, but I had my education paid for by the Air Force. And so I was on reserve duty while I was in the Air Force. And then when I was done with at least part of my training, I went on active duty and served that time. So I actually started off, I got out of medical school in 1986 and I went into a family practice program.
Okay.
And I found that I wasn't really suited to family practice. I mean,
What
I
made you
enjoyed
feel that
it.
way?
Well, I liked the generality of family practice and seeing all types of people and delivering babies and doing pediatrics and
Yep.
geriatrics and all of that. But on the other hand, I didn't feel that the specialization was quite enough for me.
Mhm.
And I found that where I enjoyed working most was in the emergency department and in the intensive care unit, because I really liked kind of the flow of things, the adrenaline of
Mhm.
things,
A lot of people
especially when
fear
you're
that.
really young. What's that?
I said, I feel like a lot of people fear that aspect of, the emergency medicine portion of healthcare is that adrenaline, the unknowns, the uncertainties. So I think it takes a special person because for me personally, that's the part that I don't love, like I don't like the non-controlled settings. So that's interesting to hear that you say that.
Well, I think that's one of the interesting things about careers in medicine or nursing is that there's so many different areas that you can choose from.
Mhm.
And I think everybody finds what fits their personality the most. And that's what's so exciting about when you're preparing to go to school or when you're in school, med school, nursing
Mhm.
school, is to explore all those areas and find, geez, where do I fit in the most? In my case, I didn't really find that until after I was done with med school. And here I am training to be a family doc. And I was
Mhm.
finding, wow, I'm really enjoying hanging out in the ICU or hanging out in the emergency department. And unlike a lot of my colleagues really look forward, and I'm so glad that people like to do this. They loved having appointments that, I'm going to see Mrs. Jones at 1 o'clock and Mr. Smith at 2 o'clock, and I'm going to take care of their blood pressure. What I found was I enjoyed being in an emergency department where I don't know what's going to happen
Mhm. Mhm.
at any moment. I found that really exciting.
I think that's
And I
awesome.
like the hours too, which is paradoxical. I think some people like to have really defined hours.
Mhm.
I actually liked having different hours and shifts, and I especially came to love the
Wow.
night shift.
That's interesting. I don't think I've ever spoken to someone with in your profession that has said that. So that's interesting to me. And just for my own, or for everyone on the AMP Honors Program, what, some people have that one moment where it's like, okay, I knew that this is what I wanted to do. Did you go through residency where you're like, oh, emergency medicine, or was it something with the Air Force that kind of sparked your interest in this, or in the family practice where you kind of knew like, okay, I want to get out of family practice and kind of transition into emergency medicine?
Yeah, that's a great question. I think the times when I noticed it the most was when I was in settings, whether it was in the ICU, the emergency department, or even on the floor, where there were kind of emergency type situations that required quick decisions and resuscitations that really made a difference to be able to think clearly and decisively and make that kind of a difference right then. And I think the people who like intensive care or emergency medicine or trauma surgery, those fields, tend to have that kind of a mindset,
Mm-hmm.
as opposed to other people would rather, I'm going to see somebody and I'm going to really think about their treatment plan over the next year and, getting their glucoses under control. It's
Mm-hmm.
just a different mindset.
Yeah,
And,
that's a good
you
way to look
talk,
at it.
what's that, Juliana?
I said that's a good way to look at it is, it is a different
Yeah.
mindset. You have to shift and look at it in that way.
Yeah, yeah. So I was into my second year of family practice, and when you have a scholarship with the military, they really have a lot of control over what you do with your career. And they had agreed that I could go and do family practice, and I realized, you know what, I really don't want to do that. I want to do emergency medicine. So I contacted the Air Force. I said, hey, I think I'd like to switch to emergency medicine. And they said, this was in 1988, they said, well, you have two choices. Either finish family practice and then you can do your active duty 4 years as a family doc, or actually at that time they had a shortage of emergency doctors. And it was such a young specialty then that they would actually put doctors, just as long as you'd done an internship, you weren't even fully trained, they would put you in the emergency department. So when I called up the Air Force and they gave me those choices, I said, you know what? I know I don't want to do family practice, so I'm just going to go on active duty. And when I went on active duty, they ended up basically saying, okay, you're not trained as an ER doc, but you're going to be an ER doc.
Oh,
And
yeah.
again, this was 1988. So, we were a young specialty. There were at that time a lot of people who were trained in the specialty, but still a lot of people were practicing emergency medicine then that had done other things and just said, okay, well, it's kind of general and I'll get by. And only in the military would they, put you in that type of situation, which was actually a really growing experience because, here I'm a young doctor. I've had 2 years of family
Yep.
practice training. And all of a sudden I find myself as an attending, practicing emergency medicine without the full training. So I ended up doing that. We got stationed in Albuquerque, New Mexico.
Okay.
There's an Air Force base there, and it had a hospital that was both Air Force and VA. So you ended up
Oh,
taking care of the Air Force active duty people, retirees, their families, and the veterans. And you did that all as an not fully trained ER doc. And so that really started to shape my perspective on knowledge and learning and how you learn and what you
mhm.
know. I knew I wanted to specialize in this field, and in order to do it, I had to finish my time on active duty, which I did for 4 years. And then after that, I decided to do an emergency medicine residency. So
Wow.
that 4 years was quite a shaping experience
Yeah.
because you end up practicing in a specialty before you're trained in it,
Hmm.
and then you go into residency and you've learned a lot of things, but on the other hand you've learned a lot of things maybe not the best way to do things, and you have to have a really open mind and you have to be really humble and you have to realize I need to learn how to do this the right way.
Hmm.
And so I did the residency in emergency medicine, and just, it confirmed my love for the field. I mean, it was absolutely, especially you've had time to mature, you know, you've been out for 4 years, you know what you really want to do.
Mhm.
And you learn at such a different level when you've had that experience, because it's like every minute of learning time is just precious to you. And so towards the end of my time as a resident, I realized, you know what else I really enjoy? I really enjoy working with pre-hospital care. You know, at the place I did my residency, the Medical College of Wisconsin,
Mhm.
you really had a lot of involvement with EMS. You know, you ran all the radio calls with the county EMS system. You know, you were working at the level 1 trauma center. And you also were a flight physician, a crew member on the helicopter. So you
Oh.
really got to take call and fly in the helicopter to do pre-hospital care, which involved a lot of settings of, you know, flying to scenes for traumas, and accidents and shootings, and then also flying to other hospitals where they had really sick patients that need to go to a higher level of care.
Mhm.
So that was a wonderful experience. So after all that, I decided to do what's called a fellowship, and that's additional training after residency. So when I finished my residency in '95, I then did an additional year as what's called a fellow in EMS. And that was one of the early years of what are called fellowships in this subspecialty. You know, subspecialties are, for example, internal medicine is a specialty,
Mhm.
and then a subspecialty of internal medicine would be like cardiology.
Okay.
Okay. Yeah, or general surgery is a specialty, and a subspecialty of general surgery would be like vascular surgery or cardiothoracic surgery. So EMS is one of the subspecialties of emergency medicine, and I did that in pretty much the early years when they were just starting to offer that as a new subspecialty. And so, yeah, I fell in love with that. And then my wife and I, we thought, well, where do we want to live? Because we had been in New Mexico, and
Mhm.
then we came to Wisconsin, which is kind of near where my wife grew up, and did all this training. And then she's a nurse,
Okay.
and
Awesome.
she's a diabetes educator. And
Awesome.
so we had enjoyed our time in New Mexico, and both of
Mhm.
us really have a service kind of ethos to us, that
Mhm.
we really like to work in underserved communities and provide service. And so we decided to go back to New Mexico. And so we went to a little town in northern New Mexico called Espanola, which is about 20 miles from Santa Fe, which is the capital of New Mexico. And
Mhm.
Espanola has a small hospital, and it's a really impoverished county there. At the time we were living there, it was the poorest county in New Mexico, and actually was the third poorest county in the United States.
Wow.
And it, at the time I was there, it actually had the highest per capita trauma abuse or trauma death rate, and the highest per capita drug abuse mortality rate. So it was a real challenge. And you were working in this very small ER in a small community hospital. Most of the time you were the only doctor on,
Mhm.
and you would get just amazingly challenging cases that you would have to, you know, handle, and if they needed more care, stabilize until you could fly them out, or, you know, sometimes admit, but very often you were transferring very sick patients to other hospitals. So it was a really good place as a young doctor to kind of cut your
Mhm.
teeth on that. And then I had the honor the last year or so that I was there, because I had done that fellowship in EMS, I became the, for the State Department of Health, the EMS director for
Oh,
the New
wow.
Mexico Department of Health, the EMS medical director. So I worked as a doctor with the State Department of Health developing policies for pre-hospital care, which
And
was also a really,
was
yeah,
that in the hospital that you kind of that department was in, or was that outside of the hospital?
yeah, that was a job outside the hospital. So
Okay.
in the hospital, like the first 3 years I was there, I worked as an ER doc, and I directed local EMS, our local paramedics. And then the last year or a little over a year, I worked both as an ER doc at that hospital, but then also worked at the state level. So, you know, with the State Department of EMS and other hospitals and other doctors, and serves on the committees that helped set the policies
Mm-hmm.
for caring for patients outside of the hospital.
And did you enjoy doing the policy piece of it? The, you know, like the more of the educational piece, is that kind of why, and I'll kind of get into the piece now, how you're more of an educator, is that correct? Now that,
Yeah,
okay.
yeah, and we'll talk about how my life is. I think it's good to have an interesting life with unexpected twists and turns.
I
It
agree.
makes your life interesting. So, I think the thing I enjoy most, other than the thing that I really loved doing the most, was practicing medicine at
Mm-hmm.
the bedside. But the thing that I enjoyed most, other than that, is being an educator
Mm-hmm.
and teaching and training. I don't so much enjoy, I think it's a necessary thing to do, but I don't enjoy working at the highest policy levels.
Mm-hmm.
I just don't enjoy the politics of it.
Mm-hmm.
I think politics is very interesting, but it's not something that I really enjoy engaging in. And doing that type of policy is very political.
I
It
can
helps.
imagine. I can definitely
Yeah,
do that.
yeah. And,
And
and see, and that's an important thing, because you will have opportunities to do lots of things. And I think it's important to, as you go through your life, look at what are the things that I enjoy doing most,
mm-hmm.
and that also really suit my personality, and that where I can contribute the most and also enjoy it. Like, I know that I do a good job at pretty much everything I've done professionally,
Mm-hmm.
but I know there are certain things that give me especially give me joy and satisfaction. Those are the things that I gravitate more towards. And I think it's the best way, in my opinion, to live life is to find the things that you enjoy the most, that become a passion, and that aren't a drag to you, or that you don't enjoy so much. There are other people that enjoy that. Let them do the things that they enjoy.
Mm-hmm. I think that's important for anyone to hear, is just kind of, you know, you were talking about even in when they had brought up in the Air Force, do you want to continue with family practice, or do you want to kind of do emergency medicine? And it sounds to me like you've kind of become comfortable with being uncomfortable, especially in a situation where, you know, you aren't trained and you're just kind of tossed into, you know, whatever's thrown at you. And I think, you know, those are situations that even I can speak to, that sometimes we learn the most and the quickest in situations where it's not very controlled and you are just kind of thrown in. Do you feel that, you know, during that time in New Mexico where you weren't trained, that you learned almost more than when you were going through residency? Or would you say that you learned from both situations that you were in?
I think that's just a beautiful way of phrasing it. I think that when I was untrained and working as a doc in the ED,
Mm-hmm.
that it was a real challenge, because you learned your limitations of what you learned how to know what you don't know, and you learned how to ask for help, and you learned how to be humble in what you know. And everybody should do that, whether they're trained or untrained, because I don't care how well trained you are, you're always going to be in situations that are humbling and overwhelming. But
That's
I think how you deal with them really counts. So I think having that situation where I was kind of thrown into, hey, you're an ER doc now.
yep.
Oh, wait, this is what I wanted to do, but I wanted to get trained fully in it first. And oh no, I'm an ER doc now without being fully trained. It was stressful, very stressful at times, but on the other hand, it was a period of really focused learning. And then it was also a period of learning about yourself
Mm-hmm.
and how well you handle those types of situations, and developing your style for dealing with situations like that. So yeah, I think it was a really growing period. And then residency was incredible, because here I was around really accomplished, fully trained ER docs and seeing, oh, that's how they do it. But at the same time, I was saying, wow, I can see the same chaos and out of control
Mm-hmm.
situations that existed when I wasn't trained. They deal with it a little better, but the bottom line is that they've got the fundamentals to fall back on.
Mm-hmm.
And I think the biggest thing that you learn when you're training as a medical profession is to know your limitations and then have the ability to interact with others to get the help that you need, because your bottom line mission is helping people.
Right.
And your bottom line oath is do no harm.
Yes. And I was just going to kind of ask a question about, for students to hear, and for me as well, is not to be fearful of asking questions. So if there's, if maybe explain to me and anyone else that watches is, how would mistakes that you've made, how is that kind of improved your practice, like going forward? Like maybe you made a mistake 20 years ago. How has that kind of changed your perspective or your way of practice today?
I think that's just a great question. When I was in medical school, I went to medical school from 1982 to 86, mistakes were something people didn't talk about.
Mm-hmm.
And people you'd hear about mistakes and people would say, oh boy, did you hear about that? Did you hear what they did there? And they would almost imply, well, that happened to somebody else. That'll never happen to me
Mm-hmm.
or to my patients. And people were ashamed of making mistakes. And I think the big change that's happened over the last 20 years or so is that we're all acknowledging that we're just human beings. And that as human beings, we are fundamentally flawed in that we will always make mistakes. But one of the ways we can make up for that is by learning from them.
Exactly.
And not being ashamed of them. And one of the concepts, and I don't know if we'll have time to talk about it, but one of the guiding principles in my professional life is a concept called just culture. Have you heard of that in your training yet as a nurse? Or?
I have heard bits and pieces, but I think your explanation would help me understand it a little bit more. So I'm curious.
Yeah. Well, just culture is something that's pretty much existed in the aviation industry for a long time, or at least they try to follow just culture in the aviation industry. And so basically the basic precept of just culture is that all human beings are flawed, all systems are flawed, and we all work in systems. So therefore errors will be made. And so our goal is not to punish people for errors and not to make errors a subject of punitive action, but to make errors a subject of learning and growth for everybody. Because one of the problems you have is if you live in what's called a culture of blame, where if somebody makes a mistake, they're blamed for it and punished. If they're blamed for it and punished, what that creates is an atmosphere where people don't want to report errors. They don't want to talk about it. Lots of near misses occur. For example, maybe a nurse accidentally almost gives the wrong dose, 10 times the dose of a drug that she should have given, but catches it at the last minute. And she hadn't done, let's say, the correct checks on that dosing, but she caught it. Well, in the past, people would have just gone, whoa, no harm, no foul. I'm just going to forget it. That's a term that just belongs relegated to the past, and it's still used a lot. And really what it's saying is, hey, you almost made a mistake, but you caught it, no harm, just don't talk about it. You don't want to draw attention to yourself. You don't want to get punished. No, it really should be the opposite. It should be, hey, I'm going to tell my colleagues and our system about, I almost made this mistake. And you know why? Because I was distracted by this. And this step in our double check, sometimes it doesn't work because it's really easy to pass over that and to overlook it. And by having somebody who has the courage to do that, everybody goes, you know what? That's happened to me too. Wow, let's change the system.
Change, exactly. It's if you
And
don't.
then somebody is.
Go ahead. Sorry.
No, that's okay. You go ahead.
I was just gonna say, I think that goes into not only just medicine, but anything in life. If you don't, recognize things that need change and you don't bring them to the surface for everyone to hear or talk about or give their own insight on, change can't happen. So I think that's important that people kind of own up to, like, yes, I made this mistake or this near miss, but, like everyone's doing it. if people kind of know like, oh, this person made this mistake, this person made this mistake, people aren't as fearful to kind of own up to it, I guess you could say. So
Yeah.
yeah, that's a huge point.
I think one of the biggest benefits of it is that it creates a sense of responsibility and accountability. And actually, it takes away fear as a motivator for not making mistakes and replaces it with a sense of responsibility and
Yes.
accountability. And it also gives you a sense of ownership in what you're doing,
Yep. I was just going to say
right?
leadership as well. I think
Yes.
it, brings up that sense of, I can be a leader. I can own up to my mistakes and teach people, and then be their mentor when they have a near miss, or, just kind of let them know, like, it's okay. Everyone makes these mistakes, but it's like what you do afterwards that means more than like what happened in the past.
That is so well put, because I think that no matter what your role in a healthcare organization or any organization,
Mm-hmm.
I think that we're all leaders,
I
okay?
agree.
And, in my career as a doctor, I met leaders that were my colleagues, nurses, techs, x-ray techs, the janitorial staff, the security staff. To me, I look at as a leader is somebody who takes responsibility for what they do, takes ownership for what they do, is concerned about the welfare of everybody they work with and their patients, and wants to teach. To me, those are the fundamental aspects of being a leader. And I think anybody is a leader. I don't care where you are in your training. When you're a med student, when you're a nursing student, when you're doing your first clinical, you
Mm-hmm.
can be a leader. And that also brings up the point, there is no such thing as a stupid question.
I completely agree.
You
That's
know,
ingrained
and
in my
and
head.
I think what's that?
I said that's been ingrained into my head since the start of high school, even, because that's a fear. A lot of people fear, if I ask this question, but there's some statistic out there that a certain percentage of the classroom is thinking the same question, so you might as well just ask it. That's kind of what we were taught as
Yeah.
well. Yeah.
Yeah. No, I mean, as long as you are sincere in what you want to do and that you want to learn, then there isn't. I mean, I think if you insincerely ask a question, it can be a stupid question, but it just depends on your motivations uh,
Absolutely.
for asking it. Yeah.